Hi everyone, welcome to another EMA Knowledge Share. Today, EMA Council member Chris McCarthy, who heads up the events team at Rathbones, is going to host, and he's going to have a discussion with Sarah Threlfall, a director of Brightspace Events consultancy, about the preparation in returning to live. Sarah, I've known Sarah for a number of years. She's worked a number of projects alongside me and been heavily involved with Chetan on Mice book. And Sarah's very much over the last 12, 18 months become a well-renowned specialist in returning to, a COVID-safe environment as we start to prepare to live. However, prior to unleashing those two on you, just a quick little catch up on a few things within EMA. Please, can I remind everyone about the importance, about paying your membership fees. EMA is a not-for-profit association. It was created for you, corporate event profs, by your fellow industry peers. And whilst our overheads are low, we do need about £40,000 a year to operate, and as such are reliant on our membership for you guys to pay your dues. So please, can I ask you, if you've not paid, we'll be sending out a reminder tomorrow with a link. Please, can I ask you to give us some money? We're carrying on our 50% discount until the end of April, so get in quick, and then we will be changing things. Got another thing with our partner MiceBook, we're setting up a private group forum within their technology, which will allow our members to chat to one another, to post and share. It's much more interactive than WhatsApp or LinkedIn, and it'll keep you updated with things. But I just wanted to reiterate, this is a private group within the technology, so you're not going to get bombarded from them or from other people or from suppliers reaching out to you through that. You can join other groups within it, but we have our own group within that. So there's going to be a link coming through to that tomorrow. Eventually, we're going to fade out the WhatsApp group and focus on that. You may be aware that we've got two EMA working groups that have been working on DEI and sustainability. And they're really progressing very well. We've been involved in a number of cross-industry conferences. The guys are putting together systems and processes and recommendation. But basically, those two groups are going to be coming to the table and hosting a session on EMA in 3 or 4 weeks' time to update with the members and really then start to talk about these two very, very important topics and what we can do as event props within the industry. And next week's events, on Tuesday morning, we have a leaders group. So to remind people that, our leaders group is a closed group. You have to be sort of head of department, head of events to join that group. If you're not in that group and want to be part of that group, then drop Priya a line and she'll add you to that database. But next Tuesday, Anna Fox, who heads up the events at Liberty Global, has recently undertaken a major review of her policies and processes and contracting, etc., in the preparation of returning to live, so in the same vein as what we're talking about today. But she's also then going to lead the discussions at leader level on sharing some of her findings, her challenges, as she prepares to roll these out across the business. And that's very much a roundtable discussion with members. And there will be a session next Thursday, but we're just waiting to finalize our speaker on that. So watch this space. We'll be letting you know. So again, just before I hand over to Christopher to take it away, we are recording today's session and it will be posted on the EMA website for members that could not attend. So Christopher, over to you, sir.
Lovely. Thank you very much, Richard. So today's session came around as we were thinking about our Back to Live white papers that a closed group in the EMA have been working on. We will be reworking these white papers, but we really want to know, until they're out and about, what new measures can we definitely put in place. Thank you very much to Sarah Threlfall from Brightspace Events. So Sarah will be talking us through the first steps of COVID secure events. Sarah, would you like to give us a bit of background on yourself, and then also highlighting as well what Brightspace Events do?
Yeah, sure. Thank you very much for inviting me to join you. Really looking forward to this session. I am historically an event director who used to work in large agencies as one of their kind of lead project managers. And then I worked my way to a head of events for them with a variety of different clients and then looking after the team. I set up Brightspace Events 6 years ago as still a consultancy for those agents. So working for agencies when they didn't have enough skills or resources in their team, they would bring us in to help. And also doing other kind of industry consulting projects like Richard said with Mice Book and various other things like that. And so that's given me quite a range of experience of different clients across different industries and lots of different event formats in all sorts of wonderful places that we haven't been allowed to go to recently. But so as part of that, as the lead event director, I was risk assessing the events that I was organising and working with my suppliers on that. So I did some sort of practical event-based health and safety training. But since shutdown, I've been turning all of that practical experience into something that's much more high level. So I've been studying for a year for other health and safety qualifications. So I've now got a couple of IOSH certifications, and also I'm just waiting for the final results on my NEBOSH general certificate, which is it's kind of like the gateway to being an event, not just an event professional, rather just a general health and safety professional. So that would allow me, if I wanted to go into different industries, but I want to stay where I am. And as part of that, it was a natural kind of feed then to lead into COVID safety, which is obviously the biggest risk that we have at the moment. And so I've done a lot of research. I've read a lot of papers. I'm staying on top of the guidance, the legislation, and making sure that what I know and what I can talk to people about now is the real up-to-date information. So, and I've been consulting with my clients throughout the pandemic. So admittedly, it's not been audience-based events, it's been filming. But as everybody's got more comfortable with how this can happen, those film sets have got bigger. So, I was up to about 55 last month for a film set. So again, there's that real life experience of actually taking these measures and this approach and sending it through an event manager brain and out the other end. So hopefully very practical experience for everybody.
No, that sounds absolutely great. Would you like to share your screen and start walking us through the steps?
Absolutely. Okay, and do just jump in if you want to stop me. Okay, so thumbs up. Can you see my first slide before I launch into it and you're not actually being able to see it? Excellent. Okay. Yeah. So basically what I've done is condensed it into 10 steps that cover quite a general approach to the events, but making sure we're looking at this holistically and not just a tick box health and safety exercise. And they largely split into 3 sections. You've got a kind of planning, and then you've got the actual assessment, and then implementation. So the first area is to understand our responsibilities in regards to the law when it comes to doing these assessments and anything really at the moment. We have, and we always have had, a responsibility under the Health and Safety at Work Act to keep people safe who could be affected by our work activities. And that extends into a management regulations responsibility to write down a risk assessment if you've got more than 5 employees. Now, that's still there. And actually, the COVID situation comes underneath that act. It's covered by the health and safety legislation because it's a hazard, it's a risk in your workplace. So you have a responsibility to address that risk in existing health and safety law. So normally, hopefully, everybody already does this. So we would expect you to have a health and safety policy, risk assessments that you would complete for your normal working activity in an office, but also, you know, when you go out and then do events and an extra activity, it should be risk assessed underneath that. And also part of that responsibility is making sure that your contractors and your suppliers are also following the correct legislation and are taking the measures that they should be taking to keep everybody safe. So hopefully you've already got experience of having a dialogue with the people that you work with and internally that is about health and safety and reducing risk. So the thing to consider at the moment as well is that with coronavirus, because it's so media friendly in a way, there is a real reputational responsibility as well for your organization, because should there be an incident at your workplace or at an event that you're running, it's very likely that it could get out into the papers and it would obviously have quite a serious impact on your business reputation if you were linked to that. And there's a slightly more subtle version, which is that if people were attending your event, nothing happened, no outbreak, no inspection, no fines, no, you know, it was just all went as you thought it would, but they felt unsafe. That's potentially a reputational impact as well, because you've got, you know, the old saying that people will say, they'll tell 10 people if something went wrong and only one person if it was a good experience. So what you kind of need to be careful of is that people feel safe, otherwise you could get some not very great feedback that starts to spread. So the difference now that we have legally, as well as those kind of other responsibilities, is that it does actually specify in our new coronavirus regulations that we have a responsibility for risk assessment. So your responsibility it's a big culture shift, I think. Historically, we're not a high risk industry. You know, we're not a nuclear power plant or an oil refinery, but we are now a high risk industry. What we're doing, bringing people together in you know, groups in spaces, is a high risk. So we need to be led by health and safety now, really, and it's not something that just gets kind of bolted on. It really does now need to be integral to your planning. So the responsibility for COVID safety is an extension of what we're already doing. It's an additional hazard that you have to address. Otherwise, you could be in breach of the existing health and safety, or you could also be in breach of the coronavirus, which would be fines and enforcement notices and all that stuff you really want to avoid. So even
should we be speaking to our employers to see if health and safety at work it's been updated since the coronavirus? So would we be expecting them to have made changes to policies and things?
Absolutely, yeah. I think most employers should be by now, you know, if people are back in offices and that sort of thing, we would expect to see a general COVID safety policy, an updated risk assessment that specifically addresses COVID risk, you know, in your normal activity. So and that is a separate assessment to your, at the moment, it's a separate assessment to your normal health and safety. And it's a good point about updating general policies, because particularly evacuation and fire policies often contradict COVID safety, because it's about, you know, assembling people in sometimes a small area. So those sorts of things absolutely should be updated. And it's a kind of coming on to the next point now, but we would definitely advise that you then have a discussion around COVID safety policy for events and how you then want to sort of take hopefully an existing organizational policy and just tailor it to your event activity. The specific legal requirement we have is covered under the coronavirus legislation, as I said, in section 7 here. It's very specific, which is good really, because greys is difficult to work with, but this is very black and white. So it says here that the gathering organizer which is what we become, has the first requirement is that the gathering organizer has carried out a risk assessment that would satisfy the requirements of the management of health and safety at work regs. So we have a legal stipulation there to do a risk assessment. It goes on to say that you have the requirement to take all reasonable measures to limit the risk of transmission of coronavirus. So the assessment itself isn't enough. You have to actually be taking action to limit the risk of transmission. And then very specifically as a final sign off, it says taking into account any guidance issued by the government which is relevant to the gathering. So this is belt and braces really, because as I see it, this was already covered, to be honest, under the Health and Safety at Work Act, but they've just been super specific. I also think, and it's worth saying because this is a big question at the moment, there's a misunderstanding / miscommunication from the government about what's going to happen on the 21st of June or later. For first thing, those dates could move. The text in the document they've released says that the legal limits on social gatherings will be, or the aim is to lift them. Okay, the social gatherings is the first point, and legal limits. It makes no reference to mitigations being lifted, measures being lifted, or your normal health and safety responsibilities being lifted. So I think it's important to understand, and an analogy I like because it's familiar for us as people in events, is the swan. We all know the swan analogy, that everything on the surface is wonderfully calm and the event's going well and everything's kind of underneath the surface. The planners and the people who are involved are working furiously to keep that level of serenity. And that's, I think, what COVID planning will be like, is the guest experience may be nice and normal, but underneath, to make that normal happen, there's going to have to be a lot of extra health and safety work for us in the planning. So I need to skip on a bit, sorry. So because this is such a massive change, because this is hugely legal, it's really important that when you're having those first conversations, they come from top, or at least you're having them with the top of the organisation. There's likely to be extra expense. There's likely to be some expectation management with your customers, with your stakeholders. So it needs to really be led from quite a senior level in your organisation. It might need more resource or some restructuring of activity to provide this extra work that needs to be done. So if it's coming from the top, the people have got the authority, the budgetary sign off, that sort of thing, which is important. But also if other people in the organisation see that it's being led by senior leaders, then your buy-in and your process in general should be smoother, because they see that this is important and will be able to follow.
So this is a point to when we're putting together proposals, when we're putting together costings, literally just to find out as much information as we can on, is there going to be extra space needed for people to be doing tests on site? Is there extra space for catering because people can't be so close together when they're working in the kitchen? So this is a time to gather as much information so that when we're speaking to the senior management, we know what the extra costings and extra difficulties might be.
100%, and it's a lovely segue then into the next bit, which is that this has to start from the beginning. Yeah, there's so many variables, there's so many additional possible expenses, or just decisions to be made around that expense, and they're the kind of decisions that should be at senior level. Do we want a bigger venue so we can have the same amount of people but distanced, or do we go for a smaller venue but reduce our audience and have half of them on a hybrid situation? So these are big decisions about and it's all about your event objectives, what we're hoping to achieve. Start with that. I think if the danger is here, particularly with this concept that the 21st of June is a magic wand and we all travel back in time, I think that the tendency is to want to recreate what we used to do, and say, well, we're going to do a COVID safe networking and drinks reception and dinner, and it's going to look exactly the same. It's going to be much more successful and a nicer guest experience if we can try and reinvent what we're doing. Keep it with the event objectives, but really kind of challenge everything about how we used to do things. Keep the learnings of our virtual year. Is there any content that actually would work well in a virtual delivery? Can we split this event and do a bit of it virtual, but the real, stuff where we have to be in person, we're going to do that in person? And really consider your event design about, you may be offering hybrid, so people are choosing to come to an in-person event, or they're choosing to access that content online, or it could be that they physically can't attend, so they have to access it online. But you've got two different experiences there that need to be planned, and you need to deliver a reason, for them to come. They're quite used to sitting on their sofas and going to conferences now, so the expectation around that live in-person section is high, and you don't want the whole thing to just be contained by measures. You don't want it to feel really clunky and horrible. So the more you can do at the event design level, the less you have to do then later on. The more you can do that fundamentally changes your risk. Smaller groups, rotations, a big reliance on tech, starting to really go for the apps and the interactive experiences. Can you kind of use measures to your advantage? I think that's sort of the thing, and you can do that if you start early enough. So if you decide that roving mics are obviously a terrible idea in this environment, so we're going to do apps for Q&A. If you know that nice and early, you can go, oh, right, okay, what else can we do with this app? Can we get some really good pre-event engagement going? Can we kind of do polls throughout the day instead of just on while we're on screen? So another one that you can kind of make advantage of is that staggered arrivals often will reduce your risk quite significantly. So can you segment your audience? You might not normally have done it, but you need to this time. So actually, can you make that work for you so that you deliver different content or specialized content before you then bring everyone together? So there's some real opportunities here, but it's very important that the discussions are had right at that initial brief discussion, and that they're challenged. Any kind of, well, we want to do it like this, why? What can we do? Is there anything we can do that will improve the safety but also possibly improve the overall delivery?
What tips have you got for bringing on stakeholders that are perhaps a bit more resistant? So we did it this year, we did it this way last year, I don't want to change it. Why aren't we doing it this year?
Well, I think trying to sort of look at the opportunities and try and present it that way, that we could use this for better engagement. We could do X, Y, Z, which will, benefit your objectives as well as the attendees. But I mean, that legal responsibility is a fairly clear one. It's something they absolutely have to do. They have to do it safely. And if you just try and do a risk assessment 2 weeks before your event, you're only really left with people have to stand quite a long way apart. They all have to wear a mask, and we need a complicated queuing system to get them in the venue, which is just, it doesn't really deliver that kind of experience. You might still need all that stuff, but if you've done your event design carefully, you can actually remove some of those measures because you've taken action somewhere else. So I think that guest experience is a good idea, and the reputational feedback. If your audience come to your event and decide that actually they either didn't feel safe or they felt overly restricted, that's not what you want either, is it? So you've got a few angles, I think, to kind of come at people. Yeah, and the expectations are high. I think people are so keen to get back to events, but they do still have this, well, if I'm going to take a whole day to go to it, when in fact it would have been a couple of hours on my settee before, it's important that we deliver a really cracking experience for them, I think. So the next sort of part of this, once we're up and running, we've come up with our fundamental event design. We need to really work with everybody around us to make this work. I think because this is so new, we don't have decades worth of best practice and experience to rely on. The more you can involve your stakeholders, the better. And by stakeholders, I was struggling with the word, but it's everybody. It's your speakers, your internal stakeholders, your budget stakeholders. It's your suppliers, it's your agents, it's your venues, it's your staff who will be on site. It really is. The more people that you can involve in this discussion about making this safe, the better. Obviously, there's different times when certain people aren't relevant to the conversation, but you need to make sure that you're talking to all of them about it at some point that's relevant. For two reasons. The first reason is they are likely to have some very good ideas. Trying to do this in a vacuum is very difficult. So the more ideas you can gather, particularly from suppliers, who are out there doing it more often, brilliant. But also, once you've involved someone in a conversation, I mean, this is just general, this isn't health and safety specific, but once you've involved someone in a conversation, they feel part of the solution and they're going to be keener to, make it happen, or encourage other people to make it happen. So that two-way communication for the whole of your network is going to make it a lot easier.
And for me, the key part of that is getting the suppliers involved from the beginning as well, because so often suppliers are really just sort of given a directive to what you do after everything else has been planned and decided by everybody else. But they will have been working across lots of different venues, lots of different stakeholders. I think they'll be invaluable to what they can add to the conversation.
I completely agree. And, I've had it myself, where I was working with in film and TV, and I ended up with makeup artists and things like that. I've not had that experience before. So we spoke to them and said, right, what are you doing normally? What else is happening? How do you normally work? What's the standard out there, and what do you actually do, and how can we help you with your measures? And it needs to be, because it's, this is a new way of working, and if people have had the experience, benefit from it. Don't try and, like you said, don't try and dictate what the rules are. Come up with them together, I think.
Yeah, I just think like suppliers, caterers at venues, they might need twice as much space as they did before, because there is still social distancing between people at work, and all that kind of thing as well. So I'm a great believer in getting them on board as early as possible.
And that's a great point there about the knock-on effect of other measures in other things, so you might sort of say, well, yeah, we're going to do the entry system this way, and that's the queue. If it's too late, you might get to the venue and they're like, well, you can't do that because we have to use that entrance now for staff testing or something, so it really does need to be a two-way to spot if measures that are introduced by one supplier actually have an effect on the other that they weren't previously aware of. So it's really vital that we're a team on this.
Yeah, brings us nicely on to use the science.
It does. So we've when we start now looking in much more detail at the actual risks, the actual hazard that we're introducing, the science is where it all has to come from. The principles of a risk assessment is that you identify the hazard first. That's the first column. You look at that before you do anything else. You don't introduce face masks and queuing systems and then worry about why we're doing that. We start with the hazard. So it's important that we understand it. And we keep up to date with the science, because the science changes a lot faster than the guidance keeps up. The trick is trying to sort of drown out, or filter out rather, the media news about science and work out what actually is going to be coming through next, because sometimes there's lots of studies that say one thing and then the week after there's a study that says something else. So it's trying to spot trends, I think, rather than actually relying on specific studies, because quite often as well the media will pick up on a study because it's sexy and it sounds good. And then you look into it and you think, well, it was only sort of very small sample size, very, unique set of circumstances. This probably isn't representative of anything that's going to be replicated on a larger scale. But yeah, so spotting trends in the science and repeated themes is very important. The methods of transmission with coronavirus is your key bit of knowledge. If you are clear that you understand how coronavirus is transmitted, you are going to be able to write a risk assessment, carry out a risk assessment, and make decisions about your event with COVID safety in mind, if you understand how it moves about. So there's three main ways that coronavirus will move. I'm hoping that most people are sort of familiar with these concepts, but it's a very good opportunity to just remind everybody. And the key really is that you need to consider all three for every activity, every opportunity. So the most obvious one is direct transmission, person-to-person transmission. So, you know, coughing and spluttering over somebody, or, you know, having virus on my hand and then I shake your hand. And it's so long ago since we've shook hands, I sometimes forget to say that bit. But so direct person-to-person transmission is your first one, and that's solved by distancing massively. The droplets that you sort of excrete when you cough, shout, sing, the larger ones fall onto surfaces. The surface, and that gives way to surface transmission. So either, you know, door handles or desks or things can carry infected particles, which are then transferred via the mouth or nose to the next host. But they do need a host. They do need a host. They will eventually die. So if an infected particle lands on a surface that's not touched, eventually the virus dries out and it dies. So that's why we can quarantine things. And also the virus is surrounded by a fat layer. And if that fat layer is destroyed by detergent or by alcohol, then the virus will die. So that's what all the hand washing is about. But it doesn't need to be sanitizer. It can just be soap. So you've got, there's two methods there. The third and most dangerous is aerosol transmission. At the beginning, they didn't think this was an issue. That is not the case anymore. It's definitely a problem. And there's lots of case studies and lots of science now that is firmly behind this as a method of transmission. So when you talk or sing or shout, tiny weeny little particles come out with all the big ones, because they're so small, they just float, they hang around in the air, they move in a very odd way that you can't kind of just say, well, they're only going that way. They disappear off all over the place, and they gather, they build up in concentration. So that's a very short little visual, oh yes, of somebody standing in a room, and after an extended period of time, if there's no ventilation or inadequate ventilation, you do end up with quite a significant concentration of aerosols that obviously someone else can breathe in. So that's not solved by distance. It's not even solved by the person leaving the room. It's solved by ventilation or not producing as many in the first place. So that's what a face mask, a face covering is designed to do in this instance, is that it's designed to reduce the number of aerosols that are being pumped is the wrong word, but released into the atmosphere. So aerosols and airborne transmission are a key one for us. I mean, you think about a networking reception and the volume as people start to talk louder and louder and they're nicely kind of close together. This shows that, you know, the difference between silent production of aerosols compared to shouting and singing at the bottom corner, it's really quite a distinct difference.
And what about stakeholders that think if we just trundle along to the Bath and West show that none of these things are going to be important or relevant? So how do we manage the difference between internal events and events that might be taking outside or events that might be taking place in the marquee?
It's absolutely true that outside it makes a massive difference to aerosol transmission, absolutely huge. So the BMJ did a fabulous grid of your risk factors for airborne transmission and your reduction measures and how they can impact that. So there's a great little reference where you can say, well, I'm outdoors, but I'm high capacity for a long time and no face coverings. And you kind of, you put all those things together and it says you're low, medium or high risk for transmission. So that's a really useful tool to take to people and say, look, just because you're outside, you've still got quite a lot of risk factors. And according to this grid by the scientists, it still shows you as being a medium or a high risk of transmission. So that's a very useful tool. And when you're outside, direct transmission is still very much an issue because the droplets aren't affected by ventilation, and contact transmission is very much still an issue because they are also not affected by airflow. So, your measures, I talk quite a lot in my training courses about sliders, like you imagine you've got either a sound desk or something like that. If one of your sliders is quite high, then you need to move all the other sliders down. Or other way around. If you can go, brilliant, ventilation is not an issue, we're outdoors, so you whoosh that one down, but it does mean that you need to kind of up the other not up the other measures, but they don't go away. That slider is still there, so it becomes a balance of where is your risk, prioritizing your danger zone. So outdoors, really, your danger zone is people not social distancing, because that's when you're going to still get transmission. Does that answer that one, Chris?
Yeah, definitely. Yeah. Thank you.
Okay. So the sort of next part of the puzzle is that you've got your hazards. You're understanding, right, okay, I know how the virus moves around. I want to understand how I can work safely. The good news is you've got lots of guidance to follow. And this guidance is really quite specific. It's quite practical. And you've got two different versions. There's the government guidance, and then you've got event industry guidance. So the government have issued everything through their website, the Working Safely During Coronavirus page. So Google that and it will lead you straight to this page. And it has several guidance documents depending on the industry that you're in or what you're doing, or for venues and things, what they class themselves as. Which does make this quite challenging, because the beauty of events is that they do tend to be quite different, and there are lots of different Venn diagrams where guidance crosses over and is relevant to 2 or 3 different things, and you need to kind of work out what it is you're doing, where you're doing it and why you're doing it, before you can really answer the question, which guidance do I need to follow? But in principle, there are some key ones that are more relevant and will come up more frequently than others. So I'll just quickly show you that. So this is the page. Can you all see that window now?
Yeah.
And so they've specifically said there's different guidance for weddings, but hopefully I don't think anyone's going to be doing those. And then it comes down into more specific industries. So heritage locations, if you're doing an event at a lovely country house or National Trust property, so they may be looking at that guidance for their main operations. Hotels and guest accommodation have separate guidance, but that is largely focused on the accommodation element and not meetings or anything like that. Performing arts. So if what you're doing could be called a concert or a performance, then you have performing arts guidance to refer to. Restaurants, pubs, bars and takeaways. Maybe if you're doing something that involves a pop-up restaurant or some kind of catering that's brought in separately to a hotel or a venue, then you may need to look at that, or they should be looking at that. But finally, the biggest one, which affects most of what we do, is hidden in the visitor economy. So the business events guidance is in the visitor economy section. And then that one itself splits down into sort of 2 biggish things, but the main one is about managing operations and managing visitors. So I haven't got time to deep dive into that at the moment. We do it on the course, but it's, like I said, it's good practical advice about what to do, how to do it, and the sorts of things that you need to be thinking about. So it talks about floor markers, queuing systems, one-way systems, hand washing, hygiene, staggering arrivals, a lot of things that we are getting quite comfortable with that will be part of our future, possibly, maybe, crystal ball, but that are definitely detailed in this guidance. So these are really good. The problem with these is that they don't go beyond where we are. They don't go beyond step 2 at this point. So we don't know what the government are going to tell us about operating in step 3 and 4 because they haven't released it. So this is one of the big challenges for everybody trying to plan ahead at the moment. The question,
without a crystal ball, when would you see these things being updated by the government?
Well, this time, so before we moved into the 29th of March, they were updated on the 22nd. So they were actually, which is what they said. They said that they would update everything a week before, which is very unhelpful. If you're trying to arrange an event for the 20th of May, you're only going to find out what the guidance is a week before. But it may be that they will update them a little bit further ahead of time once they get going into what's called the event research program. So the event research program is a big part of the roadmap about how we come out of this, and everything that we're told is subject to the results of the event research program. So it may be that once that gets underway and they start making decisions on things, they'll release updates a bit earlier and we'll say, from step 3, this is what will happen, and from step 4, we hope this will happen. But at the moment, we haven't got that. So it will eventually just come down to your risk assessment and what you decide to put into place. I think they'll take away the legally mandated things, but they will definitely leave your responsibility to make your own risk assessments.
We've got about 20 minutes left and four sections to go. So our next one.
Okie doke, I will speed up. Thank you for the reminder. So the government guidance itself references 3 associations that have also produced industry-specific guidance: the MIA, the AEO, and the EIF. The MIA is focused on mostly venues and what I would call traditional meetings, conferences, training and events, so that's a really strong section to review. The Association of Event Organisers includes the All Secure Standard, which you might hear venues talking about. It includes a lot of detail about exhibitions, but that's not to say that it doesn't apply to normal events, but it is aimed more at that exhibition level. And the EIF is outdoor events. So that's the 3 ones that come from the government guidance. It is only guidance. You do need to be led by your risk assessment. If you've identified a risk that's not covered in the guidance, it doesn't mean that you get a free pass just to ignore it. You need to kind of make sure you've covered it. But equally, don't start with the guidance and apply everything if it's not necessary. Make your own judgments as to what is a necessary risk reduction measure. Is it actually a risk of transmission or not? Again, these are updated, and again, there's not a system to know when they're updated. You just have to check. But I keep a hub on my website, so you can sign up to that, and whenever we get updates, we email out and say, oh, there's stuff coming up, check out the latest version. So that's one option. Very quickly, this is filming guidance. We are being led largely by the APA commercial filming guidance at the moment, and they've also issued lots of other information about testing and things like that. So they're a really good organisation to have a look at if you're doing virtual events. The next bit of your risk assessment is just to be really methodical. We recommend using a health and safety sort of standard system based on a plan, do, check, act model, which means that you then start to look a bit more holistically at things, and introducing those kind of reviews and checks is a really important part of this risk assessment. We don't want a list of things we want to happen on site. This is behaviour led, a lot of these measures. So we need to make sure we're putting things in place to make sure they actually happen. You know, we need to be checking what we're doing as well as actually doing it. And the more methodical you can be, the more consistent you're going to be, and the less likely you are to miss something. So it's just, people who do events are very used to, you know, imagining the whole thing and walking through it in your head, and you just do exactly the same process, but you just spot those risks of transmission at every point, and then you put the measures in place to reduce that risk. So we have quite rightly been very focused on stopping the risk of transmission of the virus, but we do have another big risk as event planners, which is that somebody who's absolutely vital to our delivery is suddenly not available because they have to isolate. So you do need to plan for that. Just make sure you've had the conversations. Ideally, you've got a backup plan in place and everyone knows what that plan is. So it could be, the obvious one is a speaker, but it could also be a supplier. If one of your suppliers is really specialist or just has such an intense knowledge of your business that, you know, you'd really struggle to replace them, make sure you come up with a strategy to cover that eventuality, and also do what you can to reduce the risk of it happening. So don't put all your speakers together in a room a day before the event, because if one of them wakes up with a cough, you really then need to isolate all of them, which could be really something you really don't want to have to deal with. So same with event teams, you know, try not to put everybody in one space, try to keep someone as a virtual member who could be brought in at the, you know, if necessary, but just make sure it's part of your planning for isolation impact as well as transmission. So the final bit's implementation, and a huge part of your implementation is going to come down to your communications. It's a cornerstone of this risk assessment. You know, I've mentioned the risk is people-based, therefore a lot of the measures are people-based. So we need to tell them what we want them to do. We need to tell our crew what we want them to do. We need to tell our speakers and our internal stakeholders what we need them to do. Because it's ever so important that people are leading from the top as well, you know, leading by example on site. So it's ever so crucial. But also from a mental safety perspective, we need to reduce what we can in terms of risk there. So anxiety levels are high. If we can tell people what to expect, then that reduces their anxiety. But also if we can reassure them about everything we're doing to keep them safe, then that will massively reduce their risk, their anxiety and mental safety as well. So there's a lot of you know, compelling reasons that we need to be communicating. The general theme as well is to over communicate. You know, we wouldn't normally blast out risk assessments to people who are coming to our events, but actually the advice is to publish your risk assessment on either your event website or your normal website, and then link to it. So send people, you know, a few things as well, that use that kind of nudge theory, that they start to get used to the idea of what will be required, rather than a big old list of rules arriving 2 days before they get there. And it gives them a chance to open a dialogue with you and ask if they've got any questions and all that good stuff. But, you know, send something that's user friendly, but has an option to view the full details if you need to, just to do that reassurance. And we would expect people to be sharing full risk assessments with the staff and crew, and anyone who's kind of working on the event should really have access to the full assessment. So communication is absolutely vital.
And would you say in these comments as well, so probably 99% of my events are organised in central London, and it's a feeling of, until people are happy with public transport, they're not going to be happy coming along to things. So is this a good point to put in, remind people that they can get to places in different ways, rather than use tube, and to sort of like maybe highlight car parks that are around, if anybody, not that many people drive in central London, but to give people options to know that if they don't want to get public transport, there is other ways.
Absolutely, yeah, and it's something that, you know, should be coming out when you're doing your risk assessment, is that you've introduced a risk, which is that your venue is central London and people would normally travel. So what can you do to reduce that risk? And reminding people to explore other options is absolutely a measure. Could you change your times so that you're not making people travel at rush hour so that they're on less crowded public transport. I mean, and it's also potentially part of your venue selection, is that should we do this in central London? You know, we used to do it in central London because everyone loved jumping on the train and it was easy. But actually, if 50% of my audience don't want to get on a train, London's a terrible idea. So it's one of those things as well that you challenge right at the beginning. But if you do go with that, then your risk assessment will lead you down the path of saying, yes, please use this car. There is a car park, or we will pay for car parking. Discussions you don't need to have normally, but you do need to have now. Yes, definitely. And then my final one is technology, because, you know, the solutions that are out there are incredible, and they're getting better, and everyone's kind of throwing money at the problem. So it's something to seriously consider again at that sort of budget stage, is that you might need additional investment, because you can reduce contact and you can reduce time. They're big things for risk, and they're also big things that can be addressed with technology. Registration's a big one. You know, get it away from doing everything off-site, online, on your phone, QR codes, scanning, face recognition, check-in, number counting, scanning, anything that means you don't need a person present is a risk reduction. We've mentioned own devices for Q&As, for polls, for accessing content. You know, explore that option as a technology. And then you've got physical distancing beacons. So you can give people little kind of things to wear that will flash or buzz if they get too close to somebody else. So that can be a less restrictive, less obvious way to encourage social distancing without putting great big screens and queuing systems everywhere, you know, so that's quite a nice option. And also comms on site. Just make sure that your staff and your team have a way to talk to each other that doesn't involve them having to kind of whisper. And we often do quite a lot of talking in corners, don't we, so that people can't hear what we're saying. But we need to sort of just provide people with a way to communicate on site that doesn't involve that sort of contact. So I will finish there because we don't have very long, I'm sorry, but hopefully we've managed to kind of cover some stuff as we've gone along. And do you want to fire some questions at me then at the end?
Yes, so we've had a couple of questions in the chat. So slides will be available after the webinar, and they'll be available on the EMA site. We've had a question. What do you think, or what would you see the outcome would be if a company has not carried out a documented full risk assessment for an event and something goes wrong? So has the government said there would be any fines or anything like there is with travel or anything?
Yeah, I mean, you're breaking the law. Is the short answer. So if you come under scrutiny and the HSE inspect your non-existent document and say, well, you've broken the law, they can fine you. And the fines are, if it's under the Health and Safety at Work Act, the fines are unlimited. It's unlikely to be an unlimited fine because those sorts of things tend to be for fatalities and things, and it would be incredibly difficult to prove that somebody caught it at your event. But if there was like a little mini outbreak and that prompted the local authority or HSE to come and ask for your documents, if you didn't have one, it's a fine under the Health and Safety at Work Act, basically.
No, that clears that up. Anything from the group? So does anybody want to unmute and ask any questions for Sarah at all?
Sarah, it's Richard. Hi.
Hello.
I know that you do, I mean, you know, any courses or recommendations of that for anyone? I know that you also do offer to go in, and you have done both with some agencies and also some corporates, which I'm aware of, that you've gone in and helped them put their policies and processes in place. Yes. Because you've kind of got the documentation now, you can fast track them.
Yeah, absolutely. I think that there's a couple of different ways that I've done it. Either it's a specific event, a specific activity, and I've consulted with them and worked with their suppliers and produced all the documentation. But there's a couple of clients who said to me, we just want to get organised. We want to have these discussions. We need someone third party to lead it for us, A, because of time, or B, because of that senior stakeholder issue that crops up. So, you know, I can go in and take people through that process with a view to then saying, off you go. You know, it's in theory something that people should be able to run themselves once that initial policy making and template creation is done. Training I offer 2 different courses. So they are aimed, the first one at people who actually have to write a risk assessment. If you have to carry out the risk assessment yourself, then it's an online and a live workshop led by me, half a day. It's virtual, it's online, but so that's a full, what we call the full course. But if you don't actually have to write the risk assessment yourself, but you need to know what you're talking about, you need to have the confidence to talk to people about it, or you've got senior management who you think maybe need to be more aware of what's going on behind the scenes, there's a shorter course which is online only, so people can kind of do that whenever they want, and it just covers like an executive summary really of everything that event managers will be doing as part of this next phase. So there's 2 options there, and we're happy to offer the EMA a discount, which will be coming out in the newsletter tomorrow, I think.
That's great, thank you.
One more question has come through on the chat. So when coronavirus very first started coming along, it was like cloakrooms were banned, badges were banned, any sort of touch points were banned. What do we think about going forward? So is there any suggestions around logistics about cloakrooms and badges? Is this something we shouldn't offer, or is this something we would work with maybe an on-site catering partner to work out how they're going to manage?
Yeah, I think it will slowly, they will remove the specific instructions. I think slowly they'll take out the little things that says you are not allowed to do private dining, you are not allowed to have more than 30 people. They'll take those out, but they will leave the risk assessment process there. So it becomes a decision that you make as an individual organizer. You look at the cloakroom, you look at the space available, you look at how many people are coming in, how the staff can operate, you talk to the venue and say, right, where do you do your cloakrooms? Can I see the risk assessment for your cloakrooms? And you plan around it, and you do the sliders until it kind of comes out as safe. So if traditionally, which is what's going to happen, the hotel have got a purpose-built cloakroom, but it's very small, the staff have to be all on top of each other, that's probably not something the venue are comfortable using. So then you have a conversation that says, right, okay, well, have you got a syndicate room so that we can have a much bigger cloakroom? And how can we do a tagging system that doesn't involve us all getting really close to each other? Can we do a place and step back for the ticket? There's lots of things that can be put into place that will make it an acceptable risk. So, but again, it will depend on the overall picture. I mean, something I didn't mention, but is the overall audience profile. Are they likely to have been vaccinated? Will they have done lots of international travel? Have they got any vulnerabilities in them? So there's a whole picture that needs to be built up, and then you put your assessment in place underneath that.
Where's the best, one final question before we finish in a minute, where's the best place to find an up-to-date risk assessment? Would we still be using ones that we've already got, but just making sure we pick up the new risks? Or
the advice and the best practice at the moment is to have 2 separate assessments. So you keep your normal event risk assessment as that, and then you do a separate risk assessment that just focuses on coronavirus and the risk of transmission. It can be simpler because you don't necessarily need to do the big matrix every time, because it's the same hazard, it's not different hazards. So there's templates on the HSE website, there's templates on the AEO website. It just depends what your activity is, depending which is the most appropriate, and our information hub has links to all of these places. So the Brightspace website, the COVID-19 page, you can just explore that basically, and every time it's updated, it will be dated, so you'll see what's gone up recently.
That sounds great. Thank you, Sarah, for spending time with us. It's been really, really useful. I know I've learned lots of things as well. Just to remind everybody, Sarah's details will be going out on the EMA website tomorrow, and you'll then be able to find out how to interact and how to work with her on making your events going forward as COVID safe as it can be.
Definitely.
Yeah, and a big thank you from me, guys. I can't emphasize enough to members that your level of responsibility of this. This is another level, and you've got a responsibility to your guests, to your corporation, to look at your supply chain management, to be asking them for their processes and policies and everything else. And you've got to document all of this. So you've got to have a file with signed documents in it. So God forbid something does go wrong, if you're asked for it, you can show that you have done a health and safety check.
Yeah, 100%.
Okay, guys, on that happy note, more work for everybody. Thanks again.
It can be done. It definitely can. It's happening.
I think once you put it into a routine, it's boom, boom, boom. But yeah.
Thank
All
you
right, guys. Thank you, everybody.
Thanks,
Bye-bye.
everybody.
Have a great weekend.
Cheers then.